Hello, my name is Shelby Sanders, and today I will be presenting over the horrors of the Zika virus. Here's a little overview about the Zika virus. What is the Zika virus? Well, the Zika virus is a flavivirus that can be transmitted through the bite of the mosquito called Aedes aegypti. Some examples of flaviviruses include the West Nile virus, the dengue virus, and the Japanese encephalitis virus. Um, some uh, some people can be affected by the mosquito and receive diseases such as the yellow fever and dengue fever. So where did the Zika virus outbreak occur? The 2015 outbreak in Brazil prompted the World Organization, or WHO, to declare a public health emergency of international concern. What raised concerns about the virus? The biggest issue regarding the Zika virus is that it caused babies to be born with microcephaly. Microcephaly causes the baby's skull to partially collapse. Also, microcephaly can cause learning disorders, speech impairment, vision disorders, and hearing loss. Another concern regarding the virus is that it causes the Guillain-Barré syndrome. This disease damages the myelin sheath, causing paralysis in adults and older children. Some mild symptoms of the virus include fever, rash, red eyes, headache, joint and muscle pain. A severe symptom is pregnancy complications. Pregnancy complications that include fetal loss, stillbirth, and preterm birth. The Aedes aegypti was discovered 400 years ago during the European slave trade with West Africa. In 1947, the Zika virus was first found in rhesus monkeys while a scientist was trying to do research on yellow fever. 5 years later, in 1952, the Zika virus was first identified in humans located in Africa, Pacific Islands, Brazil, and other South American and Central American countries. Then in 2015, that's when they had the huge outbreak in Brazil. There are no vaccines for the Zika virus right now, but scientists are trying to discover one. Scientists in the study discussed the immunogenicity of ZPIV, or Zika Purified Inactivated Virus. They utilized a randomized, which means they chose their participants randomly, and double-blind experiment, which means neither the participant or the scientist knew which regimen the participants were receiving. Also, they gave some participants placebos. They used a Zika purified inactivated virus to make their regimen. They injected their participants with the regimen. Some participants received their regimens on week 0 and week 4. This is called the standardized regimen. Some participants received their regimen at week 0 and week 2. This is called the accelerated regimen. Some participants received their regimen at week 0, which means they only received one dosage. They utilize antibody titers to show levels of antibodies that are causing a positive immune response. So here are the results for the possible antiviral treatment. All the participants who took the standardized regimen had a positive humoral immune response. 80% of the participants who received the accelerated regimen had a positive humoral immune response, and participants who took a single dose of the regimen had no immune response. This study proves that ZPIV immunogenicity is shown after 2 dosages of the regimen. Furthermore, the participants in this study had mild symptoms from the regimen, such as headaches, fatigue, and pain at injection site. There has been no report reports of the Zika virus infection since 2016 through 2017 in Florida. COVID-19 is a huge outbreak that is occurring globally today. The sad part about this outbreak is we don't know when it will stop affecting people negatively. Here are my acknowledgments, and that